Okay, we're going to start with our physical assessment. We have our patient Christiana. So while she's walking in here, I'm observing her gait. It was smooth and even, good foot placement. She had well-balanced movement. She had her arms swinging. All right, and I'm observing her posture while she's standing here. She's erect. She doesn't seem to be slouching, doesn't lean to one side or the other. So can you tell me what your age is, Christiana?
I'm 36.
Okay, so that's appropriate. She looks like she's 36. If she looked a little older or younger or whatnot, I would question that, maybe do a little further investigation. She looks like she's developed sexually fine. Can you tell me what today's date is?
Today's April 19th.
Yes.
It's Saturday.
Okay. So she knows the date. Do you know where you're at?
I'm at the clinic.
Okay, perfect. And who is the president?
Barack Obama.
Perfect. So she seems to be orientated. I'm looking at her skin color. She doesn't appear to have any concerning things that I can notice right off the bat. She's dressed appropriate for the weather. It's a nice day outside. She has symmetric facial movements. I don't see any drooping on one side. I'd be concerned of a stroke if I did. She looks appropriate for her height and weight. I'm not concerned of that. I would take those measurements, obviously, or maybe the person that admitted her brought her in. So another thing that I'm looking at is nutrition-wise. I'm looking, obviously I said weight already, and then I'm going to look at her body fat distribution. And just general appearance, it looks like she is distributed correctly. She has the hourglass figure. I am going to look for any obvious physical deformities, which I don't see any. She doesn't seem to have any fractured digits, arms, nothing's of concern. She has good eye contact. She has appropriate expressions for the situation. She smiles. She's just appropriate. She is able to articulate clearly, which demonstrates her speech as well. And her personal hygiene also seems to be within normal limits. So general appearance, I would say that she is a healthy 30-something female woman. And I see no concerns at this point. So we will continue on. Head and the neck. Just a quick overview here. So I'm just going to feel her head, note any deformities, and I don't note any. Just palpating that. I'm going to look for the size, the shape. It all looks appropriate. I have no concerns there. I'm just going to have her, can you open your jaw? Oh, okay. And I was palpating the temporomandibular joint. If she noted any pain, I'd be concerned about that. I don't. Did you have any pain, Christiana, with that?
Nope.
Nope. Okay, so just doing a quick glance too, I'd be looking at if there was any swelling. I don't note any, no edema. Like I said, I would be looking for some movement. If she had any tics, I don't see any of those. I was looking at the symmetry of her face with her movements, and those look appropriate. That's testing for cranial nerve 7. Christiana, I'm just going to have you do some range of motion with your neck. So we're going to go down, direction to your chest, okay? You can go back up and go all the way back. All right, and now let's go to the right, go to the left, and that looks good. Did you have any pain with that?
Mm-mm.
No? All right. And sometimes it's like I was doing, it's good to do it with your patient so that they can understand what they need to have done. So I'm just going to feel her lymph nodes, and I would just go feel them bilaterally and note if there's any tenderness. Do you have any tenderness with me doing this? You want to make sure you're not doing it too rough. Some things that I would be watching for is tenderness, of course. If they're swollen, if I feel heat, if they're firm, that could be a sign of an infection. Some chronic diseases will lead to inflammation, such as TB. You can have the clumped lymph nodes. Also, with cancer, you're going to have very firm lymph nodes, and of course, you would ascertain this data prior to probably in your health history report. Let's see. So I'm going to take a look at Christiana's thyroid gland. And so first of all, I'm just going to have her take a sip, and I'm going to go ahead and watch her swallow. And normally the thyroid gland moves up with swallowing, which is what it did. So first, I don't have any concerns there, so I'm going to go ahead and palpate her thyroid gland. I'm going to have you hold on to that water. And so what I'm going to have you do first is I'm going to have you just kind of tilt your head forward a little bit, and we're going to move your head to the right. And so with this, I'm going to take my left hand, and I'm going to displace your thyroid gland to the right side, and I'm going to have you swallow another glass. Oh, yep, that's perfect. I can feel it without it. And so I just want to make sure that I can palpate it, feel it move up with her swallowing. If it was firm, I would have some concerns possibly to cancer. I'd probably refer her elsewhere, and I'm going to have her do it on the other side also, again, just displacing it, and I can feel it go up with her swallowing, and so I have no concerns at this point with her thyroid gland. And ask about if there was any discomfort while doing that, of course. And so I think we could check out the symmetry of your face again. Cranial nerve 7, so go ahead and smile. Can you show me your teeth? Perfect. Now frown. Perfect. Blow out your cheeks. Raise your eyebrows and close your eyes tight, tight, tight. Perfect. All right, now we are going to check your visual acuity. Do you normally wear any corrective lenses, contacts, glasses? No? All right. So I'm going to have you stand right behind this line right here. So we are 20 feet from the Snellen chart. And I want you to cover up your right eye and go ahead and read me the line that you can see that's the smallest.
A, B, C, D, E.
Rebecca, was that right? Okay, perfect. Now go ahead and do the other eye. And again.
A, B, C, D, E.
All right. So I have my assistant down at the other end of the room. She confirmed that both lines are correct. Yes, she has 20/20 vision. Perfect. All right. Can you go ahead and have a seat? And I am going to just do a couple of things. Prior to looking into your eyes, I'm just going to inspect your neck because I didn't mention that earlier, and just looking at the color, the symmetry, making sure there's no bulges, and like I said, that looks fine. Can you go ahead and lift your shoulders, push against my, perfect, and that looks good. She has good strength, no concern there. And I am going to get my pen light here, just 1 second. There it is. All right, so we're going to go ahead and check the 6 phases. Okay, so Christiana, I just need you to follow the pen line. And I am just observing for any nystagmus, which I did not see. I noticed her eyelids at this time. There's no ptosis, and there was no lid lag, which is a good sign that could indicate some hypothyroidism. And also just doing a general overview, I'm checking to see if there's any cyanosis. If she had any jaundice, I could note that in her sclera. They are white. There's no concern there. Her pupils, currently, they are about 5 centimeters, which are millimeters, excuse me, which is normal, not concerned. I am just kind of doing an overview. I see nothing of concern here. There's no clouding of her lenses. I would ask her if she has any concerns with her eyes. Do you have any eye pain? Anything that we need to worry about? All right, Christiana. Okay, so now I'm just going to go ahead and check her pupils. And so to do this, I'm going to cover up one of her eyes, and I'm just going to have her look over my shoulder, and I am just going to... Oh, okay, so she had great response to that light. They constricted. They went from a 5 to about a 2. They were rapid. They weren't sluggish. I have no concerns there. I could I'm going to go ahead and look at the other light. Again, look over my shoulder, Christiana. All right, they, again, constricted nicely. There was no lag. I would be concerned if there was, maybe for some hemorrhaging intracranially. If that was the case, I would ask, do a Glasgow Coma scale, ask about headaches. But again, there's no concerns there. I'd ask if she's hit her head recently, which I'm not concerned about, again. And so, again, going on with the eyes, I have an ophthalmic scope. I go ahead and check the red reflex. Go ahead and look at that, and that looks good. I look at the cornea, looking for yellowing, whatnot, and I don't think there's any concerns with your eyes at this point. When I'm doing this, I'm also checking out her eyebrows, making sure those are moving appropriately, her eyelids. Again, no concerns. So, have your eyes closed. Tell me where.
On top of my cheek.
Okay.
Underneath my chin. Forehead.
So, perfect. That's the facial nerve. And if we had any concerns, I would be concerned, I guess, most likely if she didn't feel the sensation, that could be related to a stroke. So we don't really have any concerns. Facial nerve's intact. Now we're going to go ahead and look at her nose. So first I'm just going to observe the general appearance of it. It's midline, it's symmetry, she really doesn't have any concerns from the outside. I would then palpate the nose, noting, again, for symmetry, and if there was any bulging, any pain with palpation. I would ask the patient for any further information about nasal issues, if she's had any allergies, prone to nosebleeds, and such. And I would continue on, and I would have my otoscope. I can attach a special attachment, go ahead and look inside her nostril, and now I'm looking at the membrane inside, and it's red, it's moist, I have no concerns. Look on both sides. I would be looking at the septum, see if there's any deviation. And again, there's no problems that I noted. She had any sort of allergies. You could see some inflammation. I'd look for some drainage, which could also be related to allergies. I would go ahead and look for, she had bloody noses, any sort of concerns that she had. Again, I would continue on the face, and I'm going to go ahead and just inspect her lips. I'm just doing a general assessment. I'm looking at the color. They look like they're a nice red color or pinkish tinge. They look moist. If they're cyanotic, any sort of blue color, I'd be concerned about. If she was anemic, I could also even just see that from her lip area. If she had some carbon monoxide poisoning, I could see a cherry color, which I could also see on the inside of her mouth. But again, it's not a concern, just something to note. And so I'm going to go ahead and grab my pen light so I can get a better view into her mouth. And I'm just going to have her open up and just doing a general look around. I'm looking at the buccal membranes. I'm looking at the tongue. It looks like it's a good color. Why don't you go ahead and stick your tongue out for me? Okay, I'm just checking that cranial nerve. Again, go ahead and open up, and everything looks good. There is, looks pink, it looks moist. Her teeth are white. I would be looking for any dental cavities, which I do not see. I'd be checking her, when she's biting down, checking to make sure that everything is lined up appropriately. Any lesions in her mouth, just kind of a general go around. I would go ahead and check her gag reflex. I'm going to go, and a lot of times you're not going to tell them they're going to check your gag reflex. That might not be the best thing to say. So I could go ahead and check her tonsils, have my tongue blade, insert that. I can see her tonsils. They don't look inflamed. There's no bulging, nothing of worry back there. And while doing this, I would go ahead and just kind of poke back there. Oh, and gag reflex is intact, and so not concerned about that. Again, we're checking those cranial nerves 9, 10, and 11, I think. Anyways, so that's kind of just an overview. I would be using all of my senses, obviously. Go ahead and I'd be smelling her breath and make sure there's no halitosis. And there wasn't any, so that's not a concern. I would again ask her if she has any concerns about that area. Go ahead and look at Christiana's ears here. And so first of all, I'm just going to take a general look at both ears from the outside. I'm going to look at her auricle, her tragus, her lobes. I'm going to go ahead and palpate them, and I'm going to note if there's any nodules, if there's any pain. Do you feel any pain, Christiana? No. All right. So from there, I would, again, just kind of look at the external canal. Nothing to note there. And I'd be looking for lesions, any cerumen outside. It's normal to have some noted when you are inspecting the internal canal, which I'm just going to go ahead and take a look at this one, and then I'll do the internal canal. Again, just noting for any deformities, any lesions. So when inspecting the internal canal, I'm going to have my otoscope. I'm going to pull up, out, and away. And so I'd have my otoscope look in there. I would be checking out the canal itself, noting the cerumen, as I said. It's normal to have various amounts of color. If there's any odors coming from there, if there's a copious amount, I would be concerned. I didn't see any of that. I would go ahead and look at that ear. Same thing looking at the canal, then I would look at the membrane in there, the tympanic membrane. I want to see a gray membrane. I want it to be shiny. I don't want to see any bulging. That could be an indication of otitis media. Again, looking at the other side, I'd be noting pain also during this, which can be indicative of any sort of infection. And if it's bulging, if it's retracted, as I said, which I have not seen, so not really any concerns there. I would, again, ask the client if she has any concerns with her hearing, any family history of hearing loss. All right, I'd ask her, she's a pretty young lady, but I'd ask her if she's using hearing aids.
No.
No? Okay, so we're going to go ahead and continue. I would do my Weber's test, and to do this, I'm going to strike my tuning fork against my hand. I'm going to hold it, make sure it's in the center. Go ahead and tell me when you can't hear it any longer.
It's gone.
Okay, so I would be asking her, well, did you hear it equally on both sides?
Mm-hmm.
Yes, okay. Because there really is not any concerns, she's noting no loss of hearing, then I would continue. I would then continue to the Rhine test, and with this, again, I'm going to strike the tuning fork, and I'm going to explain to my patient before I do this what I'm going to do. I'm going to hold it above your mastoid process, and then when you can no longer hear it, go ahead and let me know, and I'm going to pull it out, and I'm going to hold it in front of your ear, and again, you're going to listen until you can no longer hear it, and let me know. So, okay, we're going to go ahead and do that.
Okay, it's gone. Gone.
Okay, so that's good. Let's do it again. We do the same on this side.
Gone. Gone.
All right, so everything's checking out. Normally the bone conduction is shorter. You're going to be able to hear it longer with the air. That's normal, so I have no concerns there. I really have nothing else to know. All right, now we're going to go ahead and we're going to continue on. I'm going to just palpate the carotid arteries. Remember, you're going to do this. Normally the patient might be laying down. You don't want to do both at the same time. You could cause them to pass out. So just noting the strength, making sure that I don't feel anything abnormal. It's rapid. I don't feel anything. I'm going to go ahead and auscultate. You're going to go and use the valve of the stethoscope, the smaller end. And I'm going to have Christiana hold her breath for me. All right. You just want to make sure that you don't get any interference with her inspiration, expiration sound. So again, I'm going to... Perfect. And I would just be noting any adventitious sounds, any bruits, any thrills. It could indicate some arterial issues, and I really didn't notice anything, so I don't have any concern there. So moving on, I'm gonna just palpate her pulses. So we're gonna do radial, we're gonna palpate both of them at the same time. Note if there's any deficit between the two. I don't feel any. I'm gonna do the ulnar pulses. They're a little harder to palpate, but we're gonna go ahead and do that anyways. I'm gonna do the brachial. This would normally be done if you had any concerns about arterial insufficiency. Again, I felt that one, that was great. Doing that there, perfect. You're gonna note the strength of the pulses, and I could feel them both well. I could do the Allen test on Christiana. So you're gonna hold down both the ulnar and radial arteries. I'm gonna have her squeeze her hand at this point, and then I'm going to have her release her hand, I'm going to release, and I'm going to note the color come back, and that's just checking the patency of the ulnar artery. I do that on the other side. A lot of times I do that with their ABG draws prior to. And now, Christiana, we're going to go ahead and check your range of motion. And so I'm going to begin with her hand, and so we can go back and forth, just the hand, there you go. So I like to call this the princess wave, back and forth. Okay, now we can go this way, front and back. We could check all the joints, all the fingers. We're gonna make sure we can even do them all at once. You can extend. Again, do some circums, scission, whatever.
Okay.
Okay. Anyways, so I would ask again, do you have any pain with any of these movements? And again, please tell me if you have any pain. Now, we're going to do the elbow here. We're going to go, this is a hinge joint, that's all we're going to see. And now we can do adduction. You want to go all the way up. You want to make sure that that's intact. But again, if there was any pain, I would stop. You don't want to go past that point. We do the same with the other arm. I'm not going to show you that right now. Just know that that's what you would do. Again, noting if there's any pain. And, okay, Christiana, we're going to do one more test. And so what we're going to have you do is the first time, I'm just going to have you take your right index finger and have your arms up. Right index finger, touch your nose. Eyes open for this first time. Okay, now do it with your left. Now do it 2 more times. Okay, then we're going to have Christiana close her eyes and repeat the test. Okay, so I'm not saying anything concerning. I would have her do it 2 more times. And I'm just noting if there's any hesitance in her movements, if she is uncoordinated, which she's not, that would indicate cerebral problems, or cerebellum, excuse me. And I don't see any deficits there, so I don't really have any concerns at this point. Again, I would just be inspecting her upper extremities as I'm going, inspecting the skin, noting the color, noting if she has any eczema, any other issues. She has some normal skin findings, some freckles, which I'm sure, Christiana, do you spend a lot of time outside? She does, so that's a pretty normal finding. I would look for any swelling. I would redness, any warmth, and I don't see any of that. I would then go ahead and check her hands and check her cap refills, and I'm going to press on it, release. I'm going to look for if it's less than 2 seconds, and which it was, so that is indicative of normal circulation to her hands. I would be concerned if it was less, if maybe she had some anemia. I'd be checking to see if there was pallor there, if she could be cyanotic. It's important to note that when checking a pulse ox, which you do during the vitals normally, if their hands are cold, if they don't have good circulation to their hands, you're not going to get an accurate reading. Now we are going to do just a basic lung assessment. We're going to auscultate. Prior to doing that, I'm just going to note the symmetry of her breast, make sure that everything is equal, that there's movement bilaterally. I'm going to note, just going to go ahead and look at her spine, make sure it's erect. At this time, I would probably inspect the back of her back, look at the skin color, sure there's no lesions, ecchymosis, petechiae, anything of the sort. I would ask the client if she has any allergies, if she smokes,
No, I
heart
don't smoke.
disease. No,
No heart disease. Allergic to cats.
allergic to cats. All right. So I'm gonna go ahead and auscultate. I'm gonna auscultate in the front first, and just take a deep breath for me, Christiana. Excuse me. All right. So you are having some normal sounds. It's always normally louder up here in the bronchial area, which is normal. I can hear it throughout. It's not diminished, which is good. A lot of times the elderly clients are going to have diminished lung sounds, which is normal. I would be listening for any wheezing. That could be some airway constriction. If we had a cat nearby, that might be something that I have heard. A lot of times I would not auscultate through the client's clothing. That might give me some false positive sounds. Also important to note, when you're listening to lung sounds, you're going to want to do each side, do one, do the other, so you can hear them both. We're just going to go ahead and auscultate the back here. All right, deep breath for me, Christiana. Perfect. And again, I did not hear any adventitious lung sounds. If there were any, I'd be listening for any crackles, which sound about their name would imply it's kind of like a crackling sound. You can have some wheezing, which again, that would be musical, which could indicate some constriction. Any sort of stridor, which again, could be related to the constriction. If you had heart failure, I might auscultate some crackles with the backup of fluid. I would ask you if you had any problems with laying down, if you had a hard time breathing, which I'm assuming you don't. Is that correct?
Correct.
All right. I would have the client breathe in and out and note the symmetry of her movement while she's doing that. And again, this is a pretty basic assessment. There's a couple other tests that we could perform. I'm not going to go ahead and do that today just because I don't have any concerns with this client. I would ask the client if she has any of concerns herself. Okay, so there's really nothing that I can see that I would need to further investigate. Go ahead and auscultate Miss Christiana's heart sounds, and you need to remember the places that you're auscultating. We're going to do the aortic first. That's going to be over here on the right side. All right. Pulmonic. Do Erb's point, a little bit lower. Tricuspid. And then the mitral valve. So normally you're going to hear the common, the lub dub. The lub being the AV valves closing, the dub being the semilunar valves closing, and you're going to be listening to any murmurs. Murmurs are common in younger children. They're something that you might not necessarily be concerned about. Grade 2 murmurs are normally innocent in that case. You can hear a split S2 sound with some people at the end of inspiration, which is also considered normal. A lot of younger children have that. Early adolescents, some athletic people also can have that auscultated. You're going to want to listen to for an entire minute normally when you're doing this, and I again would ask the client if she's having any problems while laying down, any problems breathing, any palpitations normally. I would continue on and have my client lean towards her left side. And so with this, I'm going to use the bell of my stethoscope and auscultate. All right. I did not note any S3 or S4 sounds, which should be indicated with, that would be ventricular filling, which would be noted in some heart conditions, which she does not seem to have, so there is no concern. To continue on to the abdomen. So first I would inspect the abdomen. I would have it free of clothing. I would inspect the contour. I would note any striating, any bruising. I would ask about any past pregnancies, any abdominal pain. I'd ask the client about if she has regular bowel movements, if her urination is clear, if she has any foul odor, which could indicate a urinary tract infection. Also, frequency and burning upon urination would be a concern with the urinary tract infection. I would ask if she's had any abdominal surgeries. That's important to note for continuing on with this assessment. So after doing just a basic inspection of the skin and the contour, I would go ahead and auscultate. And it's important to auscultate before you do any of the other steps, just so you don't disrupt anything. So we're going to listen to all 4 quadrants. So I listen to all 4 quadrants. I'm just listening for normal vowel sounds. If there were any concerns, I would again ask the client about any sort of constipation that she's having. You might hear some higher pitched vowel sounds if there was some sort of obstruction in there, and then on the other side of the obstruction, it would be absent of those sounds. She could have some hyperactive bowel sounds if she's having diarrhea. That's pretty common. Hypoactive bowel sounds if she's inactive, if she is post-surgical. Those are pretty normal. You want to encourage your clients to eat their fiber, make sure they are drinking adequate fluids, and keeping up on the exercise. But again, like I said, didn't note any bowel problems there. I would listen to each quadrant for about 5 minutes if I did think there was any concern. Make sure that they're hypoactive and not absent. So I'm going to continue on with my assessment here, and I would do some percussing. I'm going to percuss the bowels. I just want to lightly do it over fingers. I'm going to note if there is any resonance. You would note that there wasn't any resonance if there were bowel in her system. You would go ahead and do this for the spleen, liver also. That's just noting if she has any liver problems, cirrhosis, if she was alcoholic, that would be something that I'd be concerned about, maybe HIV positive. But again, I didn't note anything abnormal there. I was just doing the percussion part. Nifty trick that I was taught was you can use a melon to do your percussion, and it's a great way to learn what's normal, and so just something I thought I'd pass along. So I have inspected, I have percussed. You can percuss the spleen as well if you are so inclined. Also, I'll do the kidneys afterwards, but so I'm just going to continue. I'm going to do just some light palpation and ask the client, do you have any pain with this? I'm very light, just really noting any discomfort, any masses. So, Christiana, I'm going to go ahead and do it a little bit deeper, and so you're going to palpate a little bit harder. Again, noting any sort of masses. I don't know any. I would do the same with this liver. It's easier once they're exhaling to palpate that, and so you can palpate that. You can reach underneath, and again, I didn't note anything with her liver. I can also assess her spleen at this time. I would, when I was auscultating, I would have also noted if I heard any sounds lower down in her aortic region that could indicate aortic aneurysm, which would be very life-threatening and a concern for us. So I'm going to have Christiana actually sit up on the edge of the table here, and I am just going to go ahead and give the back of your lower back here a pound, and you just tell me if that hurts at all. No? All right, I'm going to do the same over here. Nope. All right, so that's just checking the urinary system. I would be concerned if she had any pain, pyelonephritis, any sort of kidney stones could be present. But again, there's nothing of concern here that I see. Sienna, I'm going to have you do it's called a shin test, and you're going to take the heel of your right foot, you're going to run it across your shin. Okay, you can go down with it. Yep. Perfect. All right, now you can do that again with the other side. So I am just checking coordination of her movements. Cerebellar damage would be what I would be most concerned about here. If she wasn't able to perform that test, which she was able to do just fine, so I don't have any concerns there. And so continuing on, just lower extremities, I'd be inspecting the skin. I'd be noting if she has any edema. You can go ahead and assess that. You can go ahead and press on the skin, note if there's any indentation, which there wasn't. Do that on both sides. If she had any heart failure, that would be something I would definitely be concerned about. Any renal diseases, I'd be concerned also. You could note also any lesions. If she had any arterial insufficiency, you would note that. Also with venous insufficiency, you can see the varicose veins. You could normally see those with patients that are working long hours, standing on their feet all day. Nurses are very prone to varicose veins. You want to make sure that you educate your patients about wearing supportive socks, not just for surgery. They're great for every day. Post-surgical patients, though, you do normally put on those tight hose, put on the SCDs, make sure that they're not going to get any clot formation. That would be a concern. So I've inspected the lower extremities. Everything looks good. Her skin color is fine. No edema. I'm going to go ahead and I'm going to palpate her feet down here, noting the patellar pulses, which I feel those are good. They're strong bilaterally. A lot of times nurses will just do these lower pulses, and but you can also go ahead and palpate behind the knees here. You can do a femoral I said, there really is nothing that would indicate to me that that is necessary at this point. I'm gonna go ahead and check her cat refill down here. It's less than 2 seconds, which is great. I do bilaterally. If there's any arterial insufficiency, that would be noted there. So continuing on, I would go ahead and check her sensations. I would do that bilaterally. I would use a cotton whisk, and I could have her tell me what I was using, where I was stimulating, what area. I do this throughout her body. This would be a good time when she's laying down. I'd also continue on to assess her pain. I could use a paper clip. That's a great one. Use a blunt one. I could also use heat and cold, and a test tube is a great way. And just, again, just various points, testing sensation. A lot of patients who are suffering from a stroke or had a stroke, I guess, they might not be able to feel those sensations. If they are diabetic, they may have neuropathy that doesn't allow them to feel that. If they have folic acid deficiency, that could also be a problem. So her sensations are good. There's no concerns there. I am going to have the client sit up and just kind of rest your legs over the end. Okay, so now I'm going to go ahead and check her reflexes. And I happen to not have a reflex hammer, but nifty trick, if you just use your stethoscope here, you can go ahead and use that. And so I'm going to take the client's hand, I'm going to just have you relax that, and I'm just going to check for the reflex. Okay, I'm going to go right here. I'm going to put my thumb here, and sometimes they're a little harder to get. So you're just going to note if there's a reflex. 1 to 3 is normal, 1 is a little slower, but that's not a concern. I could also have the client just relax her arm here and check right here, noting if the arm moves up. You can check the, we're going to go ahead and do this on her knees, and oh, there we go. So we just want to see that kick. Also, if the client was laying down, I would have checked her knee reflex there. Also, I could do her Achilles from back here, noting again if the reflex was normal, 1 to 3, 1 being a little bit slower, 2 being within normal limits, 3 a little faster, but not a concern. If it was extremely fast, I would be concerned with calcium balance. That can cause some hyperactive reflexes, also submarine reflexes, depending on hypercalcemia versus hypocalcemia. Also, along the same lines, when we're speaking of calcium, you could talk to the client if they did have any thyroid issues, if their parathyroid gland had been affected in any way, maybe with radiation, or if they had removed the thyroid gland, they could consequently have affected her parathyroid. So that's just kind of an important thing to note. I don't see any other sort of concerns. I would go ahead at this point and check the client's range of motion. And so, actually I'm going to have Christiana lay back down. It might just be a little bit easier for me to show this. So when you're doing range of motion again, Christiana, if you have any pain, let me know. We're not going to go past the point of pain, but I want to make sure I can see that you have full range of motion in all of your extremities. So you can start at the hip if you'd like, and so I'm just going to have you relax your leg. I'm going to hold on to it, Christiana, so I can go out, and so I can go out. So that would be the abduction, adduction going back in. You can note if the client can bend their knee. That's also showing the hip joint movement. So bend the knee, extend the knee. Do you have any pain, Christiana? No? Okay. So we can go on further. We can have the client dorsiflex, plantar flex. We're going to have her go on a circular motion, go back the other way. We can do the same with the toes. Note any sort of stiffness, which could be arthritis. A lot of clients have problems in the morning with that, but of course Christiana's pretty young, and she did note that she had arthritis earlier, so I'm not too concerned about that. I would do the same on Christiana's right leg, left leg, and note any sort of pain, any difficulties, any inability to perform the range of motion. The Romberg's test, Christina. And this is going to check the cerebellum function. And so I'm going to go ahead and for this test I need you to keep your eyes open and just keep the arms at your side, and we're going to watch the clock. We're going to have Christiana stay there for 20 seconds, and I'm just noting if Christiana has any swaying, if she's unable to keep that position. After the 20 seconds, I would then ask Christiana to go ahead and close your eyes, Christiana. And again, I'm noting if Christiana is able to stay erect, if she has any swaying, she's dizzy. An important thing to note is I would want to continue to stay close by in case she does get dizzy. I don't need her falling. Everything checks out on that test. And now, Christiana, we're going to go ahead and we are going to have you kind of like your child again, and we're going to have you jump on one foot. And so lift up that one foot and go ahead and jump. All right. Now you can do the other foot. Perfect. Oh, that looks great. She has good balance. If she was unable to perform this test, I would be concerned about muscle weakness, any sort of cerebellum insufficiency. But of course, everything looks good. Continuing on, I would also have Christiana perform the heel-to-toe test just to assess her gait a little further. And so, Christiana, I'm going to have you do heel first, toe next, heel first, toe next, and I'm just going to have you walk in a straight line here. So heel, then toe, heel, then toe, heel, then toe, heel, then toe. Okay, so everything looks good. Now, Christiana, we're going to do, you just walk on your heel, so heel, heel. Perfect. She is able to keep her balance, and I would continue on and have her do just her toes, and this is a great way to assess a person's gait also. I'm just noting that she's able to keep that balance. Again, I would stay with Christiana, make sure that she is not unsafe at any time and able to perform the test. If not able to perform the test, I would, of course, have her rest and sit down, but she was able to do so, and so I have no concerns with her balance. The last part of the assessment would be the female genitalia, and we're not going to demonstrate that today, but I'm just going to talk to Christiana about kind of what it all entails, just in case she ends up going to the doctor soon to have this done. And so normally, Christiana, we are just going to go ahead and first begin with just looking at the overall appearance of the labia majora, and we're going to note the hair distribution. We're going to note if there's any lesions, any discharge at this point. We go ahead and ask the client about discharge if she's noted any. If there was foul-smelling discharge, we would be concerned about infection of sorts. So continuing on from that point, we would go ahead and separate the majora, looking at the minora, the clitoris, the vaginal opening and such. Again, just inspecting for any lesions, any noted pain, any discoloration, and continuing on with the discharge, just concerned about that. So we would go ahead and palpate Bartholomew's gland, and we were going to be looking for any swelling, any tenderness, any discharge. We would also go ahead and look at the vaginal wall, or we'd look at it, inspect it, we would also palpate it, and we would do so by putting on water-soluble lube onto our gloved hands. We would insert our index finger, middle finger into the vaginal opening. We would wait for the client to relax a little bit, and then we would apply pressure, just noting the texture and if there is any noted deformities, any discomfort with that, any swelling, which could indicate some sort of infection, always a concern. Also, continuing on, it's important to palpate the cervix, your ovaries, and the ureters, which would normally be done with your checkups. Obviously, Christiana is a female, so we would not be concerned about inspecting the male genitalia, but just kind of for some reference points, a lot of the same things that we would look at for the male, we'd look at the hair distribution, we'd look at the skin color, we would want to ask about his sexual history. We'd ask if he has any dysuria, any discharge. We would retract the foreskin, and if he was uncircumcised, and look at that. We would also palpate the glands and note those, and we would ask the client if he has any concerns that we should be aware of. Also ask Christiana if she has any pain with intercourse, if she is using any oral contraceptives, also NuvaRing. We'd ask the client about any past pregnancies, anything else that she was concerned about.